Conrad Steiner, Doctor of Medicine. Tonight's story has the title, Don't Count the Stars.
Guardian of birth, healer of the sick, comforter of the aged. And the qualities of the worthy physician are three: the eye of an eagle, the heart of a lion, the hand of a woman.
Our actual case history tonight concerns the field of laryngology, science of the human throat and larynx. The object in point, a piece of sheet music, public domain. The case in point, Daniel James Castle, age 29. The past 10 years of his life have been devoted to building a successful career for himself as a singer. His efforts and his talent have not been in vain. Fortune has finally started to turn his way, and Daniel Castle is only a few steps from the threshold of success. But there are those who have met Danny on the ladder of theatrical endeavor, coming and going, and virtually every one of them remembers him with bitterness and a strange, violent distaste. For most singers, the top is a long way off. But finally and at last, Danny Castle now senses his goal immediately ahead of him. The big time, the big money.
Don't count the stars that you see in the skies. Just count the stars that you see in my eyes. Those in the skies soon may be gone. Those in my eyes are for always. Don't stop the drums that I hear in my heart. Just let them roar as they did at the start. Why stop to count Venus and Mars? Just count each kiss, darling. Don't count the stars.
The big time and the big money. And Danny's determined to make it, no matter what the cost. And Julia Winters is just one means to attain that end. Like so many others before her, to Danny, she's merely someone with a right connection. Someone to be exploited to gain a certain advantage and then discarded. And for Julia, discard time is fast approaching.
Yes, I'll tell him. Thanks a lot. Bye. Danny, you won't believe it. I just talked to Mary at the switchboard, and 20 minutes after we went off the air, the station had 65 calls about you. Every one of them great. They loved you. How about that?
Oh, it's nice, Julie. That's not bad for a local program.
Not bad. Why, it's great.
Come on, Danny. Let down. Aren't you a little excited? Even the station manager called, Mr. Brubaker. He thought you were wonderful.
Oh, that's very nice. I'll drop him a note first chance I get.
Drop me one while you're at it. I thought you were wonderful, too. Say, how about dinner at John's Grill? You know, Dan, the place we went last week. We'll celebrate. After all, it is a special occasion for both of us.
I don't like the tone of that. Better get rid of it.
Yeah, afraid so. That lousy thing. I better get home and get to bed. Maybe we can have that dinner some other time, okay?
Well, all right. I was looking forward to it. But if you're getting a cold again...
Yeah, don't worry about it. A few days, it'll be gone. Oh, look, you better run back to the studio. I'll call you in a week or so as soon as I clear this up, okay?
All right. I'll wait for your call. Good night, Danny.
Night.
Bye.
Good night, Miss Winters.
Another 2 minutes with that stupid broad, I'd have flipped. Oh, what's your trouble?
Julie's been pretty nice to you, Danny.
I took her out to dinner, didn't I? So she gave me a guest spot on her show. That's the dullest broad I ever met.
Nothing. Another one for the bone pile, huh? Sometimes I wonder why I stay with you, Danny.
It was an even trade. She got as much out of it as I did, and I forget it. By the way, what happened with the piano tonight? Were you wearing mittens or were you playing it with your feet?
Look, I don't want to worry you, Danny, but I've heard you do better, too.
What are you talking about? You been hitting the bottle again?
16 years, 3 months, not a drop. You just wearing tops tonight, Dan, and you don't.
Pal, I think I've just about had it from you. We've been together a long time, maybe too long. I think it's about time I got somebody new to work with.
Oh, you mean I'm fired again? Is that it, Danny?
No. No, I said you're fired for good. You understand? You're third rate and you always will be. All right, so maybe it's rough. But I'm not going to carry anybody along who can't cut the mustard. I've scrounged around in these two-bit dumps long enough. 12 years, and I've sweated through every one of them. Now I'm ready for the big time. I'm not going to let any sour piano louse it up.
I was never that sour, and you know it.
Are you kidding? Ike, you started in dumps like this, and this is just where you're going to stay.
All right, Dan. That's enough. All that shouting and straining, it just isn't worth it. Now, it's the voice you better be taking care of. Give it a good rest. I'll see you in the morning.
It had started fairly recently, a matter of possibly 8 or 9 weeks before when Denny Castle first noticed it. To begin with, only a slight tickling sensation in his throat, then a grating feeling, day by day growing more harsh. After that, hoarseness with a chronic hacking cough. For weeks, he resorted to self-treatment. He had his own way of coping with throat irritations. Assorted patent medicines, sprays and gargles, lubricants of one kind or another. But in spite of everything, the hoarseness stayed with him, little by little increasing, entrenching itself deep in his throat.
Hello? Oh, hi. How are you, Sid? Now, that right? What? Hey, you're kidding. Yeah, you saw me on TV, huh? Hey, that's wonderful. Yeah, Friday at the Strand. You bet I will. 2:30. Yeah, goodbye.
Persistent hoarseness, stubborn throat irritation. These are danger signs. Danny's hoarseness had been hanging on for nearly 2 months. Like most singers, he was voice conscious. Like most singers, he thought he could take care of it himself. It took the imminent audition to send him to Merle Norton, M.D., a laryngologist.
Ulcer? Oh, that can't be. Oh, I've been singing a lot lately. I probably worked my throat too hard, that's all.
No, I'm afraid it isn't quite as simple as that. A biopsy is indicated from all appearances.
Oh, no. You better think again, Doctor. Nobody's going to carve up my voice at a time like this.
Perhaps you didn't understand me when I said there may be a malignancy, Mr. Castle. There's a strong possibility that that ulcer may be cancerous.
Well, maybe it isn't.
I wouldn't want to take the chance.
Maybe you wouldn't. But I can't afford not to. I've worked all my life for a chance at the big time. Oh, don't kid yourself. Nothing's gonna spoil it now. Anyway, you're not sure, are you? Positive, I mean.
No, not absolutely positive.
Well, suppose it is cancerous. What happens then?
Well, if we get it in time, simple removal of the malignant tissue should correct the condition. You'd still be able to talk. Perhaps almost as well as you can talk now. I must be honest with you. You'd never sing again.
Gee, Ike, that was great. Well, what are you going to do with it?
Well, you know, got a couple of publishers interested.
Do you suppose that I could sing a tune for you?
You sing?
I think so. I'm not sure.
Okay, let's hear you.
All right.
What'll it be?
How about The Mountains of Morning? Do you know it?
You're a tenor, aren't you?
Yes.
All right, let's give it a try.
All right. Oh, Mary, this country is a wonderful place where the people are working by day and by night. They don't sow potatoes, nor barley, nor wheat. Sure, there's gangs of them digging for gold on the street. At least when I asked them, that's what I was told. So I took a hand in this digging for gold. But sure, all that I found here, I might as well be where the mountains of morning sweep down to the sea.
You're all right, kid. You sing up a storm.
You really think so?
Of course, it'll take a lot of work. A lot to the singing business, you know. But I think maybe you got it. Let's go see Danny. Let's see what he thinks. Hi, Danny. How do you feel, boy?
Ike?
Do you know Terry Deneen?
Nice meeting you, Mr. Castle. I sure do enjoy your work, sir.
Well, you heard him. What do you think? Kid sings, huh?
Yeah, sure, fine. Look, Ike, I want you to play an audition for me Friday. For Martin Arnold.
Why, that's great. Great, boy. This is a big break for you. You sure you want me?
Yeah, that's right, I want you.
All right, Danny. How's the throat? Is it giving you any more trouble?
The throat's all right. I just been working it too hard, that's all. Look, do you want the job?
Well, you know I do.
2:30 Friday at the Strand.
Enjoyed meeting you, Mr. Castle.
I'll be there.
In a desperate attempt to restore his voice for the audition, Danny called upon what is known in the entertainment business as a throat patcher, a man with no formal medical education, but someone who has picked up a smattering of knowledge of the anatomy of the throat. He doesn't pretend to diagnose or cure, but sometimes his patches are temporarily effective. Usually, they are also dangerous. The emergency patchwork had its temporary effect. When Danny mounted the stage for his audition, he seemed his old, confident self. Most of the hoarseness seemed to have vanished, at least for the moment.
Don't count the stars that you see in the skies. Just count the stars that you see in my eyes. Those in the skies soon may be gone. Those in my eyes are for all.
The days that followed were black days for Danny Castle. Days of a despairing, unbroken loneliness. His only companion, the fateful question which only he could answer. Surgery, a partial laryngectomy, or death from cancer. For Danny, whose entire life revolved around his singing, understandably, it was a hard choice to make. But it was his alone.
Don't count the stars that you see in the skies. Just count the stars that you see in my eyes. Those in the skies soon may be gone. Those in my eyes are for always. Don't stop the drums that I hear in my heart. Just let them run.
Danny was admitted to the hospital that night. The following morning, Dr. Norton performed a biopsy, taking a bit of tissue from the right vocal cord and giving it to the pathologist for examination. The pathologist's report: the specimen was malignant. In laryngeal surgery, a tracheotomy is first performed to ensure an adequate supply of air to the patient. Although Danny Castle will soon consider himself the most unhappy of men, in point of fact, he is among the lucky ones. Thanks to a prompt diagnosis and immediate surgical action, the lesion had not had time to spread. To assure removal of all cancerous tissue, the area surrounding the lesion must be cut away to a depth of 1 centimeter. The vocal cords are not large. If the lesion had been larger, a complete laryngectomy would have been necessary. The total removal of the larynx, or voice box. One of the lucky ones, Danny Castle. Although he was a singer with but half a voice, he'd learned that half a voice is better than none at all.
It won't be that bad for long, Danny. You'll be talking again in no time at all. It won't be long before scar tissue builds up what you might call a substitute cord. It's not the same mechanism as a normal vocal cord, but you'll be talking again in a week or 10 days. Then in about 6 months, you'll sound as if you have a bad cold, probably, but that's about all. Let's see how you're healing up. Can you breathe? Your throat will clear up and the swelling will go down, and then you won't need that little snorkel. You're not so bad off, Danny. You're alive. I think that's worth quite a bit, isn't it?
Hey, Danny, over here, boy. Come on. Oh, Danny, it's good to see you. How have you been?
You know, so.
You remember Terry?
Hiya, Mr. Castle. Nice to see you around.
You've been away for a couple of months. That's too long to keep yourself cooped up.
Sam, there's a friend down there. I'm gonna go see him.
We'll make it, boy. Look, Terry and I have a little idea. We want to talk to you.
Well, there he is. What do you know? Mr. Big Time. Real big headliner. Danny Castle. Everybody's friend.
Look, Miss Winters, we're kind of busy now. Why don't you come back after a while?
Why? I just want to talk to my old friend. Sam, come here. I want you to see this one. This is the great singer, Danny Castle. great voice. So why don't you sing big time? Come on, why don't you sing?
Julie, leave him alone, will you, please?
What for? Why should I leave him alone? He left me alone. I didn't like it. Besides, I want to hear the great singer sing. Come on, Daddy. Sing.
That's enough. You've had
Don't
your fun.
touch me. You're going to let him push me around.
Oh, no. There. You look lovely.
I don't feel that way.
Danny, if I've said it once, I've said it 1,000 times. If you're going to get in bar fights, you got to keep in condition.
Terry, sit down. Danny, look. Why don't you try a smile for a change? Face up to it and you got it licked. So you lost your singing voice. You still got guts. You always had more then than most people.
It's easy to say. Look, what do you do with a singer that can't sing?
A lot of things. Tell him, Terry.
Danny, I think you know more about this business than anybody. You're all singer. And I don't think it makes any difference that you can't sing, well, because you're that way. Ike here thinks that I've got a pretty good voice. You've heard me. Maybe you think I'm not so bad.
Potentially one of the best, Danny.
I know nothing about it, technique and that kind of stuff, you know. Maybe I'm a little out of line, but I was wondering maybe if you wouldn't teach me. You know.
He needs a lot of coaching. But who knows more about it than you? I know he's got it. You could make him one of the big ones. Put him right up on top. It'd be almost the same as being there yourself.
How can I teach anybody to sing? Listen to me.
He's already got the voice. All you gotta do is show him how to use it. You can do it, kid. All by yourself.
So you want to sing?
Yes,
You really want to sing?
that's the way it is.
You better take your coat off. We got a long way to go.
It did mean work. Months of painstaking, grinding work. And Danny's concern about his own voice was subordinated to his training of Terry's. Never a patient man, Danny learned patience. Never a tolerant man, Danny learned tolerance. Never a happy man, Danny learned to smile.
Don't count the stars that you see in the skies. Just count the stars that you see in my eyes. Those in the skies soon may be gone. Those in my eyes are for always. Don't stop the drums that I hear.
Ike, you know something?
Yeah,
I used to sing pretty good.
that's right.
I was never better than I am right now.
Why stop to count Venus and more? Just count each kiss, darling, don't